If you are having your interview for a nursing job here in the UK, don't worry, I've got you. With this video, I will be helping you not just to pass, but to actually impress your employers during the interview. Hello nurses, my name is Jake. I am a senior nurse here in the United Kingdom and I have been on both sides of this scenario. I've had my NHS Trust interview back in 2015 and in the last few years I have been one of the interviewers for nurses applying to our hospital. If this is your first time in this channel, do consider subscribing, and if you find this video helpful at the end, then please give it a thumbs up and share it to your friends. Here is a summary of what I will be talking about today. And if you want to go straight to a specific topic, you can just click the timestamp on the video description. The first thing you have to consider is who is going to interview you. This is usually written in your confirmation email with the schedule for your interview. Most likely, this is going to be one of the senior nurses for the unit you are applying to. This could be the matron or the manager, and the other interviewer will be somebody else. They don't necessarily have to be from the same unit. They could be another manager from a different unit, or a charge nurse, or even a senior band 5 nurse who will be joining the interview. For these interviewers, even if they were selected days or even weeks beforehand, it does not necessarily mean that they have read your CV or your application letter. So what does this mean for you? So you must not assume that they know your experience or your achievements, and during the interview, you really have to showcase this. So it can happen that the assigned interviewer suddenly becomes unavailable and they have to get a replacement then and there. Especially during that case, this person doesn't know you at all, hasn't read anything. All they will know just before the interview will be your name. So you really have to sell yourself. Another important thing for you to know is what type of interview you are going to have. This is just so you can prepare yourself. So it can be a short form values-based interview or a long form interview. So when you say short form values-based interview, this is made up of 3 up to maximum of 5 questions, and each question has a value that is connected to the hospital's own values. So they are testing you if your values match with theirs. So it's not very much on the technical stuff or the years of experience, but rather they are checking if you are the right person, if your values match the hospital's values. And for some hospitals, that can be more important than the actual years of experience. So if you're having this type of interview, you really have to read the hospital's mission, vision, and set of values. Each hospital will have its own values. Okay, so make sure you read that and start to think of examples or actual experiences in the past wherein you demonstrated those values, so that you can use that. If ever it comes out, then you can use that examples as part of your answers. If you are having a long form interview, this can take longer, and each question will be an in-depth look into different things, which I will mention in part 3. Whether you are applying for an NHS Trust or a private institution, your interview questions will revolve around these 5 key areas. And in the next part, I will be telling you how they may be phrased and how best to answer them. So the first key area will be your clinical knowledge, experience, and skills. Second will be your personal and professional attributes and values, and this may include questions on emotional intelligence. Third is information governance and questions on privacy and confidentiality. Fourth will be infection control. And fifth is equality, diversity, and inclusion. So for the first key area, the question may be as simple as, could you tell us about your current role and any previous nursing experience? Or it may be put into a scenario in order to test your actual knowledge and skills. So for example, they will give you this scenario. So you are a nurse on a day shift and you have been asked by the doctor to give stat medications for a patient with a confirmed myocardial infarction. While making your way towards the patient, a relative comes to you rushing, asking for your help because her mom needs to go to the toilet immediately. What would be your course of action? So this type of question will test your prioritization. So I know you are already thinking right now and you have your answer, which is to give the medication first. But it is not as simple as that. You have to explain properly on how you would approach it, and you have to explain your rationale. So your priority in this scenario is the patient with MI, because that is or can be life-threatening. Then you can showcase your experience with delegation by saying something like, if there was a student nurse or a healthcare assistant within the area, I would kindly ask them to go to that patient urgently because I have to give this very important medications first to the patient with MI. You can also say that after you've given the medication, you then go to check on that patient and the relative and see if somebody has actually helped the patient. If the interviewer says the relative wants an explanation, you have to be very careful. Make sure that you don't mention anything about the patient's case to the relative. You can say that you were giving a very important medication, but you can't go into specifics like this patient is having a heart attack because that is part of confidentiality. So the scenario they may give you for this key area can be different, but the important thing is for you to actually display that you know how to prioritize, you know how to communicate properly, and you must maintain a calm, patient, and compassionate approach to whatever the situation may be. So for this key area, it may be as simple as them asking, if I was to call your charge nurse today and ask them to describe you as one of their nurses, what would they say? So something like that. When you answer this, make sure you give a positive response without sounding very boastful or braggy. In this area, you need to mention your values that actually match with the trust or the institution's values. So again, it is very important that you go to their website, your hospital's website, and read their mission, vision, goals, and values. It may also be a weakness versus strengths type of question. So they might just ask, what is your greatest weakness? So for a weakness question, if you've done your research, you can say a weakness as long as it doesn't affect the actual role. So for example, something that you've had trouble with or struggled with and how you actually overcome it and what you learned from it that you are now applying to current practice. You can also say a weakness that is totally unrelated. So for example, you can say, my greatest weakness is my spending habits. A few years back, I wasn't very good with keeping my money. I like to buy nice things and eat good food. And a few days before the next salary comes in, it would really be a struggle. But that was a few years ago, so I've learned to control that. And now I am gradually learning how to have delayed gratification. So I'm thinking more of long-term now. They may also give you a different kind of scenario wherein you need to deal with challenging behavior from staff, from relatives, or from patients. So I will leave that for you to ponder on. If you are still watching at this point, then don't forget to subscribe to my channel and give this video a like. If this video reaches 100 likes, I will be doing another video, this time just for sample questions and how to answer them. The topic itself is a full hour training as part of your mandatory learning when you come to work in the UK. But we're not gonna do that right now. The important thing for you to remember is you must always maintain patient confidentiality and privacy. When you say privacy, that is preventing undue exposure to the patient. Whereas confidentiality tackles on person identifying information, for example, name, date of birth, hospital number, and other personal details of the patient. For this key area, the question may be as simple as what is the difference between privacy and confidentiality? Or they may give you a scenario wherein a staff breaches confidentiality of the patient information. So for example, they are talking loudly in the elevator or in the bus or in the underground train, or you saw a handover sheet in the elevator, in the hallway. What will you do? You must not ignore it. You must do something about it. So if you found a handover sheet, that is a paper with the patient's information, diagnosis, medical history, and the current medical plan. Okay, so that has a lot of information. So you must pick it up and dispose it in the confidential bin, the nearest confidential bin. If there is a name on the handover or if it says what ward it is also a plus point if you actually go to that ward and inform either the charge nurse or the manager of that ward that it has happened. This is not to punish the actual person who dropped the handover, but this is to remind everyone to be more careful with confidential data. If the scenario was you overhearing two people on the elevator or in the canteen or wherever, so you can say something like, considering that they are talking confidential information about the patient and it is now being overheard publicly, it is my duty as a healthcare worker to actually stop that. And in a very calm manner, ask them not to speak loudly the patient's confidential information, and better yet, stop this topic of conversation, and they can have this when they are back in the ward in the actual clinical setting for an actual clinical purpose. So that is not the perfect answer, but as long as you get the right flow, the right theme, that first you won't ignore it, you're gonna do something about it, and actually speak out in an attempt to stop further divulging of patient information, then that's more than enough. Next key area is infection control. So I remember this clearly because I had an infection control question back in 2015. Obviously, I can't give you the exact same question, but here's the tip. You need to know the different modes of transmissions of the different infections. So the question may be a case of prioritization or a question of what will you need in order to protect yourself. There are two very serious infections here in the UK that is not very well known to people or nurses from other country, but you need to know them because they might come up in your interview. So the first one is your MRSA, or your methicillin-resistant Staphylococcus aureus. So read about that. And the next one is your C. diff, or your Clostridium difficile. Okay, so make sure you read about that. What is the mode of transmission? What is the treatment? And how do you protect yourself? The NHS is a very multicultural organization, and equality, diversity, and inclusion is a very big thing. There are actually people who fail the interview because of their inability to answer this key area. So the question for this area may be as simple as, what is your idea of equality and diversity? So obviously you can answer this in your own words, but make sure you mention recognizing, respecting, and appreciating the differences Okay, that's very important. If they focus on equality, the important phrase to mention there is that no one should be disadvantaged because of their differences or their protected characteristics such as their gender, their culture, religion, and other characteristics. Okay, so make sure you mention that phrase. Now it is your interview day. Because you are not in the UK, it will most likely be via Zoom or Microsoft Teams. You need to treat it like a face-to-face interview. So if this was a face-to-face interview, you would arrive a minimum of 15 minutes before the interview. But because this is Zoom, that is a very long time to enter into the chat room or into the video call. So I recommend joining the meeting 5 minutes before the actual interview time. They may not necessarily open the video call or the meeting just yet, but on the other line, they know you are there. And if you are there before the actual interview time, that shows your actual interest and your preparedness for the interview. So what should you wear? You must be in a formal attire. So you really need to treat it like you're in a face-to-face interview. Make sure you've got a good posture, so sit straight and don't forget to smile, because even if you feel nervous, when you smile, the interviewer thinks that you are calm, relaxed, and that you've really prepared for this interview. Be confident with your answers. In order to do this, you must be honest with your answers. Take your answers from your own actual experience. Don't make anything up, okay? Try to avoid saying in between your words. Instead, you can take a few seconds of silence, because that shows that you're thinking without sounding like you are unprepared or super nervous. It's perfectly fine to take a few seconds to pause and think about your answer and then give a smooth and continuous answer. Because English is not your first language, interviewers don't really expect you to have a perfect English. The important thing is that you drive your point across and they understand what you are saying. At the end of the whole interview, once all the questions have been asked, the interviewers will then say, "Do you have any questions for us?" Never say no, okay? When you say no, that means you haven't done your research. That means you haven't thought properly about the job. So prepare at least 2 questions. What are examples of this question? So it could be questions about progression, advancement, and training. So for example, I've read that your hospital specializes in cancer research. If I do get this job, how long do you think will it take for me to be able to specialize into cancer research? So that question will tell the interviewers that number 1, you are interested about the job, but more than that, you are already looking forward into your progression. Number 2, it also shows that you've done your research because you know their specialty. Okay, another example. What are the opportunities for career progression or specialization in this unit? So then they can tell you that, you could become a band 6 charge nurse, or you could specialize to become a practice development nurse for that unit, or you can branch out and be an infection control nurse, blah, blah, blah. So whatever their answer may be, it actually doesn't matter, as long as you're able to show that you've done your research and you are genuinely interested in the job. At the end of the interview, make sure you thank the interviewers, because even if it is their job to interview you, this shows your appreciation and also gives off positive vibes that you are someone who is nice to work with because you appreciate other people. Right, so that is all the time we have for this video. If you want me to do another video of more sample interview questions, then give this video a thumbs up and let me know what type of questions you want me to focus in by writing them down in the comment section. Thank you so much for watching this video. This has been your helpful and informative UKRN Jake, signing off.